name's Amanda. I'm going to be your nurse practitioner today. So, what brings you in?
Developed a cough yesterday around 2 p.m.
Okay.
So I kind of want to get rid of that.
All right. So, just noticing just a cough, or you having a sore throat too?
So, a bit of a sore throat and cough.
Okay.
Yeah, the guys at work have it, and it's now made its way to me.
Okay. So, other people at your job have been coughing too, you noticed? All right. So, you were kind of just sitting at your desk or something, and you noticed you started coughing.
Yeah.
Okay. You said yesterday at 2 p.m. is when it started?
Yes.
All right. Are you currently having any shortness of breath right now?
No.
No trouble breathing at all?
No.
Okay. So you said you were sitting down when you first noticed that the cough started, and had you recently exercised or anything before that?
No.
Okay. You said that the guys were sick at work. Does the cough come and go?
Kind of. It's just pretty much persistent, though.
Okay.
It's just
kind of throughout the day.
Yeah.
Are you having any really bad coughing fits, or just persistently coughing at different intervals?
Nothing like a violent fit, just kind of interval, like you said.
Okay. All right. Can you describe the cough to me?
It's like a dry cough. There was occasional phlegm or stuff come with it.
Okay, so you are having some sputum come up when you cough.
Yeah.
Can you describe what that sputum looks like?
It's just clear white.
Okay.
That's about it, really.
Does it smell bad or anything?
Oh, no.
No. Okay. So you said it's like a dry cough. What does it sound like? A barking cough, or like wheezing, or just kind of a soft cough?
Kind of more of the soft cough. It's not like a bark like a dog or anything. It's just like
It's just soft and dry.
Yeah.
Gotcha. Does it hurt when you cough?
No, it's no real pain. It's just kind of more of a nuisance and annoying.
Okay. So no pain when you're breathing or anything?
No.
No chest pain?
No.
Or chest tightness or anything like that?
Okay.
And you're not having any drainage from your nose?
Not that I've noticed.
Okay. So is this cough, does it wake you up at night? Did it wake you up last night?
It did once, yeah.
It did? Okay. Did you have trouble falling asleep?
Yes, I did.
Okay. So would you say, is it more bothersome at nighttime than it is?
Yeah, when I'm laying down, that's when it's at its worst.
When you're laying down?
It's at its worst.
Okay. Does it feel like something's tickling the back of your throat, kind of?
For the most part, yeah.
Yeah. Okay. Is the cough? Does eating affect your cough?
No.
Or drinking water?
No.
No. Do you get a cough at certain times of the year?
No.
Okay. And does exercise or activity affect the cough at all?
No.
Okay. And you said it's worse when you're lying down. So when you sit up or you prop yourself up with pillows, does that help you when you're trying to get to sleep?
A little bit, yeah.
Okay. Was there anything that you did that stopped the cough?
Yeah, I took some NyQuil last night, and that kind of helped me at least get to sleep anyways.
Okay. So did you just take NyQuil the one time then?
Yeah.
Okay. So you said it's kind of a nuisance. Is it interfering with your activities of daily living?
No.
No, you haven't had to call into work or anything?
No.
Okay. And would you say it's getting worse, or you're coughing more frequently?
No. Not that I've noticed anyways.
Okay. All right. Have you had a fever?
No.
Any chills or night sweats or anything like that?
No.
All right. Do you have a headache?
No.
No pain in your face or anything? Okay.
Just a sore throat and cough.
Okay, gotcha. Do you feel like fatigued and tired? No, just the cough and sore throat.
Yeah.
Gotcha. And with your when you're coughing up that sputum, would you say it's a lot or just a little bit?
Just a little bit. It's not like an overwhelming amount.
Okay.
It's just there's definitely some there.
All right. Well, I'm just going to go over a little bit of your past history. We can really focus in and figure out what's going on with you, okay? When you were a kid, did you ever have pertussis or pneumonia?
No.
Whooping cough, anything? Okay. Have you ever had tuberculosis?
No.
Have you been tested for tuberculosis?
Yeah, last year they gave me the skin test.
Oh, okay. Was it
negative?
It was negative. Gotcha. And have you ever had rheumatic fever?
No.
All right. Do you have any history of heart problems?
Nope.
Asthma? Ever had an abnormal ECG?
No.
It's like the heart electrodes. You know what I'm talking about. Ever any history of HIV?
Nope.
Heart disease?
Nope.
High blood pressure?
Nope.
Okay. Have you been immunized for pertussis or whooping cough? Usually when you're a kid, you'll get it.
I think so.
Did you have all your childhood immunizations?
Yes.
Okay. And did you get a flu shot this year?
Yes.
Okay, great. And have you had any facial or nasal surgeries?
No.
Okay. And have you ever been hospitalized for having difficulty breathing?
No.
Any recent respiratory infections?
Nope.
Like flu or anything?
Uh-uh.
Okay. And have you recently experienced any physical trauma to your head or neck?
No.
Okay. Or your chest?
Nope.
Okay. Are you taking any prescription medications currently?
No. Other than just that NyQuil.
Just
the one
NyQuil.
time.
Okay, no vitamins or supplements. And do you have any allergies?
No.
Okay. Does anyone in your family have allergies?
Not that I'm aware of.
Okay. Do you own any pets?
Nope.
All right. And what do you do for work?
Sales.
Work in sales, work in an office?
Mhm.
Okay. Are you exposed to a lot of like toxic chemicals or anything doing that?
No.
Okay, I didn't think so, but just thought I'd ask. Are you around a lot of dust or pollen?
No.
Okay. Did anyone in your family, has anyone ever had asthma?
No.
Your siblings, mom, dad, grandparents?
Nope.
All right. Any history of heart disease or high blood pressure in the family?
Nope.
Okay. Diabetes or obesity?
No.
Cancer or kidney disease?
Nope.
All right. Moving right along here. Do you smoke cigarettes?
No.
Have you ever in the past?
No.
Okay. Do you smoke any substance of any kind?
No.
Are you exposed to secondhand smoke?
No.
Okay. Do you consume alcohol?
Yes.
How often and how many drinks do you think?
1 to 2 drinks a month.
Okay. Have you noticed any change in your ability to exercise because of the cough? No. And are you concerned about domestic violence? We ask all of our patients that question.
No.
Okay. All right. So with this cough, have you noticed recently any change in the color or texture of your hair or skin? Any change in the color of your nails?
No.
No blue coloration around your lips or anything like that?
Nope.
Okay. Have you been sweating more than normal?
No.
Any swelling in your neck or pain in your head or your facial area?
Nope.
Any recent injuries?
Nope.
Any change in taste or smell?
Nope.
Difficulty breathing through your mouth or nose?
Nope.
Any bloody secretions
No.
from your cough or your nose or anything?
No.
Okay. Have you had any earaches?
Nope.
All right. Any change in hearing?
No.
Or dizziness or vertigo or anything like that?
Nope.
All right. Have you had a racing heart?
No.
Like fast heart rate or anything? Palpitations?
Nope.
Have you been getting up more frequently to urinate, like in the middle of the night or anything like that?
No.
Okay. Feeling dizzy when you stand up?
Nope.
Do you have any numbness or tingling in your feet or hands?
Nope.
Nope. Cold hands or feet?
Nope.
All right. Any swelling in your legs or your feet?
Nope.
Do you have any concerns about sexually transmitted infections?
Nope.
Any changes in your level of consciousness? Like, have you been confused randomly
No.
or lost consciousness recently?
Nope.
Okay. And have you had any rashes on your skin or anywhere? No allergic reactions or anything? All right, Mr. Smith. Well, I think that covers my little questionnaire here.
Okay.
What I'm going to do is I'm going to do an examination of your chest, your lungs, your heart, and the vessels in your neck, okay?
Okay.
We're going to try and pinpoint what's going on with this cough, okay?
Okay.
All right. So what I'm going to have you do, I'm going to step out of the room. I'm just going to have you remove your T-shirt and just say when you're ready and I'll come back in.
Okay. Alright, I'm good.
Ready? Alright. Make sure this is still recording. Alright, I'm going to have you face this way, and I'm going to come around to your back. Actually, you know what? I'm going to remove these. And be careful, that's broken. I'll have you slide over. And let's see, can we turn, just trying to get it on the video. What we might do. Alright, and I'm just going to place my hands on your back, and when I tell you to, just take a deep breath in and a deep breath out, okay?
Alright.
Alright, go ahead. And one more time. Alright. And did you experience any tenderness or anything? No pain when I'm touching?
No.
Okay. Alright, next thing I'm going to do, I'm going to put one of my hands on your back, and I just want you to repeat the phrase 99 over and over again until I tell you to stop, okay?
Okay.
Alright, go ahead.
99, 99, 99, 99, 99, 99, 99, 99.
Okay. Alright. Now I'm just going to take a listen to your lungs here. I'm going to warm up my stethoscope. And I'll just have you breathe normally like you would regularly, okay?
Okay.
Okay, now I'll have you take a few deep breaths in and out.
Okay.
Alright, and this last round, I'm going to listen to you with my stethoscope, and I just want you to repeat 99 like you did before, okay?
Okay.
Alright, go ahead.
99, 99, 99, 99, 99, 99, 99.
Alright. So now I'll have you turn around and face me. And I'll make sure we're still getting it on recording, okay? Alright, take a few deep breaths in and out. Okay. I'm going to do the same thing I did on your back with my hand. I'm just going to place it on your chest. I'll have you say 99, okay? Alright, go ahead.
99, 99, 99, 99.
Okay. just gonna feel around and let me know if you have any pain or anything, okay? All right, no pain? Okay. Okay, for this next portion, I'm gonna have you lay supine, so we're gonna go in the room next door, okay? All right, Mr. Smith, I'm just gonna feel some of the vessels in your neck, okay?
Okay.
All right, I'm gonna listen to them. Okay, and I'm gonna listen to your heart now. Okay, I'm gonna push a little harder with my stethoscope. It has a feature on it that lets me hear your heart a little bit better if I push down a little harder, okay? Okay. So now I'm just gonna have you roll over onto your left side. I'm gonna listen to you again. Okay, and now I'll have you sit up and kind of scooch over toward this side so that we still get you in the video. Perfect. Okay. And now I'm just going to feel some of your pulses. So I'll have you put your wrists out. I'm going to feel your radial pulse. Yeah, that'd be great if we could remove that. Thank you. Okay. Now I'm going to feel some Actually, I'm going to feel your brachial pulse before I go down to your feet. All right, now I'm just going to feel the tops of your feet. Let's see if we can, gotta make sure I get this on. You can just relax them. Okay. Is this foot relaxed? Let's try and let's move this one out from underneath. Yeah. Okay. I can put this up again. All right. Well, Mr. Smith, your examination looks normal. I didn't hear any abnormal breath sounds or anything down deep in your lungs. I did hear just a little bit of upper airway congestion, sort of like what you've been talking about, that sputum that I think is draining down into the back of your throat, and it's causing you to feel that tickling and causing you to cough. So it's good that you came in right away because based on my initial assessment findings and the color of your sputum and the symptoms that you've described, I'm thinking it's probably viral. But what we're going to do is go ahead and just swab you, and we'll see if this is flu or a different type of virus. But I'm going to go ahead and start you on an antiviral, and they're pretty effective in the first 48 hours after symptoms start. So I'm going to get you started on that based on if we do get results back that it is viral. Otherwise, if it's something more bacterial related or just it could be related to some kind of allergy that you're having, have you been tested for allergies?
Mm-hmm.
You have, and you know that you don't have any. Okay. Mm-hmm. So my guess is probably viral, but again, we're going to do some testing and we'll go from there. Okay? All right. Did you have any other questions or concerns?
Nope.
All right. Well, thanks for coming in.
All right. Thank you.
Okay, patient Matthew Smith is a 27-year-old Caucasian male who appears to be his stated age and not in any acute distress. The patient came in with a complaint of mild cough and a small amount of clear sputum. Patient states no shortness of breath, difficulty breathing, chest pain, or edema. The patient denies any recent history of respiratory illness or infection. No family history was significant for respiratory or cardiac disease. The patient denies smoking cigarettes or other substances and works in a well-ventilated office. The patient reported that his last TB skin test was done 1 year ago with a negative result, and he has never had a chest x-ray. His last EKG was last year with a normal result. On assessment, the AP diameter was less than transverse diameter. Respirations were relaxed, unlabored, and even, counted out at 16 breaths per minute. Chest expansion was equal and symmetric. Tactile fremitus equal bilaterally. Palpation revealed no tenderness, masses, lesions, or swelling. Resonance to percussion over lung fields. Lung sounds were clear and equal to auscultation with no adventitious sounds noted. The patient's carotid pulses were brisk and equal bilaterally with no audible bruits. No visible pulsations were noticed on inspection of the precordium. Apical pulse was distinguished at fifth intercostal space at the left midclavicular line. His heart rate was assessed to be 68 beats per minute at rest with a regular rhythm and rate. No S3, S4, or extra heart sounds. No murmurs noted, with regular S1 and S2. Radial, brachial, posterior tibial, and dorsalis pedis pulses were noted to be 2+ bilaterally, and neck vessels were healthy by inspection and auscultation. My recommendation for this patient was to do a respiratory swab and send it down for testing to the lab to figure out if a virus was present, and then if so, since the patient came in within 48 hours of the onset of the symptoms, I was going to start him on an antiviral therapy if the presence of a virus was determined.